So I'm Rowland Rees. I'm a consultant urologist in the UK, based in Southampton and in London. And I'm primarily a surgeon, but I also see medical conditions as well. I chose urology primarily because it's a huge area of need. Men's health is not particularly, or certainly when I started training in urology, wasn't particularly being done very extensively or very well. And men are sometimes reluctant to come forward, and there's various other barriers, really. So when I was coming into surgery, I realized that this area would be an area of growth, and it indeed has done that over the last 20 years. It's become disease of the prostate and genital problems through a variety of reasons have become more, awareness has increased, and we're seeing a lot more patients coming through. So that was the main reason, I think, is that there's an area of demand and an area of need. I've chosen to work in reconstructive urology or andrology, men's health, male genital surgery. And in those sort of areas, there is, again, there's a lack of provision in a number of areas. And secondly, I think most of the conditions I deal with are quality of life issues. A good example being incontinence, for instance. And it is fantastic to be able to offer men a better quality of life through surgery in this area. And I do find that quite rewarding, to be able to improve their lives, and they're extremely grateful as well. And I do enjoy dealing with that particular population group. So what do patients value about me? I suspect it's the dedication and a subspecialization to the problem area that they've got. And they are very often glad to see a urologist who specializes or is taking a specific interest in their particular problem. And I have specialized within a small area of urology to do with men's health and male genital surgery. There are a number of conditions, but I do surgery for these conditions often in high numbers, and therefore they're often grateful to see someone who has done a lot of surgery in the particular problem that they've got. Well, the challenges that I get are often problems that have not been solved elsewhere, and I do see quite a few people for second opinions from other urologists, and therefore the challenges are really solving difficult problems sometimes. And there are some particularly related to scar tissue, people who've had previous surgery, and of course that makes surgery more difficult if people have had previous treatments. So yes, there are some difficult conditions, particularly around revision surgery, around Peyronie's disease, around urethral stricture disease, or maybe men who've had radiotherapy who need treatment for erectile dysfunction, for instance. All of these areas are surgically challenging. And the other challenge is managing people's expectations, because nowadays people do have sometimes quite high expectations of what is possible in the sort of medical arena. And of course, it's a case of making sure that we're on the same wavelength and making sure that the expectations are realistic.